This is Dr. Ben Pearl. Today we're going to review post-op nail procedures. So when we do an ingrown toenail procedure, be it one where we ablate the root, a matrixectomy, or just a regular standard removal of an ingrown toenail, we have some post-op procedures that we're going to do. First off, if we look at the contour of the nail that we will remove, and here is a schematic that shows you that border that's growing in, we want to make sure that we don't wear a shoe that's going to be constrictive after. So sandals or a very wide shoe, and I'm going to show an example of a wide shoe. This is a zero shoe or ultras, but really any generous shoe that you want. Crocs can sometimes be worn as well. Something that isn't going to press the new margin of the nail right back inside. What about dressings? When to take them off? Usually I say 24 hours. You can take a bath that same day, but with your foot outside the bath. We like to keep the dressing uninterrupted for 24 hours if we can. And then what about the dressings themselves? We have a post-op pack we have here. This is the standard stuff we like to use. Gauze. This is something called Coflex. This will wrap around and attach to itself like Velcro. And then you can use either a gel like this wound gel that we have here, or iodine. We don't like to use Neosporin or bacitracin. Those tend to be more viscous and they clog up the area. What about return to sports? So return to sports, generally I like to give it at least a week to 10 days depending. If you're doing skiing, hockey, those things can be a little bit longer just because there's going to be more pressure. I have had patients that have gone on vacation and done that, but it's sort of at your own hazard and risk for the new nail to be pressed in again. What about post-op pain? Usually Tylenol or ibuprofen, 1 to 2 every 4 to 6 hours is all that's needed. I rarely will prescribe a narcotic because usually it's not that painful. And then other things to know: if there's bleeding, you can overlay the dressing with more gauze and more wrap. It is good to keep it elevated, especially the first 24 hours. And you can put an hour on, several hours off, but a period of elevation helps with both pain and with making sure the area gets clotted. If you have any other questions, certainly you can contact our office, our emergency email, arlingtonfoot@gmail.com, and you can get a hold of the doctor, me, or the doctor on call.